appeals and denials and physician advisor services here at Covenant. So if we want to go ahead and go through the TDCI team, and then we'll start with our payer partners.
This is Lisa Jordan. I'm the Assistant Commissioner for the TennCare Oversight Division in the Department of Commerce and Insurance, and I sit on the panel as the Commissioner's designee.
And I'm Patricia Newton, Patricia, Newton, Newton. I am the Compliance Manager for the TennCare Oversight Division.
Sherry, this is Lisa again. I failed to spell my name. It's Lisa, Lisa, Jordan, Jordan, and I believe that's all we have from Commerce and Insurance.
Okay. Is there anyone from the Bureau, the TennCare Bureau, on? Okay. If not, we'll go ahead and start with Blue Cross, Blue Care.
Hi, this is Pat Sullivan, PATSULLIVAN, and I'm the Chief Operating Officer at Blue Care.
Thank you, Pat. Anyone else joining you?
Hello, this is Mike Wynn, MikeWynne, and I work with Pat in Blue Care as the Compliance Officer.
Okay. Anyone else? Okay, we'll move on to AmeriGroup.
Good afternoon. This is Linda, Linda Williamson, WILLIAMSON. I'm the Director of Health Plan Operations and currently the interim COO.
Thanks, Linda. Linda, anyone joining you?
I do not believe so.
Okay, we'll move on to our friends at United.
Good afternoon. This is Kim Maltempo, KIMMALTEMPO. I'm the Manager of Health Plan Operations for United.
Okay, Kim, anyone joining you?
No, I don't believe so.
Okay, is there anyone else on the call that we need to recognize? Okay, if not, we'll go ahead and proceed with the agenda.
Sherry, excuse me, this is Lisa again. We have one more panel member that we need to introduce. So if you'd go ahead, please, Dr. Turner.
Hello, my name is Chris Turner, CHRISTURNER. I'm representing Murray Regional Health and the Chief Medical Officer for our employed physician group.
Welcome, Dr. Turner. Okay, if there's no one else on the call, we'll go ahead and start with the agenda. So, Patricia, I believe we hand it over to you to review the summary of requests for independent review and provider complaints.
Yes, as you'll notice, we received a total of 264 requests for independent review this year. The AmeriGroup total was 26, the United total was 38, and the Blues get the prize. They had 199. Most of the ones concerning the Blues were from East Tennessee Children's Hospital, Murray Regional, and Baptist System, the one in West Tennessee, the Baptist in West Tennessee. We anticipate that the numbers coming in for independent review from Baptist and East Tennessee Children will start dropping off some, and I'll get into more detail on that when I finish with the provider complaint report. Does anybody have any questions about this report? Oh, okay, then I'll proceed on to provider complaints. As you'll notice, our year total was 843, which was significantly higher than last year, as was the independent review request. In the fourth quarter, as you'll notice, we actually had 264, which was the largest amount for the year. The total for AmeriGroup was 236. The total for United Healthcare was, for their TennCare line of business, was 112. And then for the Blue Care Volunteer State Health Plan, for their TennCare total, they received 296. I think the spreadsheets have been distributed to you all as well, and you'll notice in the spreadsheets that the 3 providers that I mentioned in passing are shown both in the provider complaint spreadsheet and in the independent review spreadsheet. There's been quite a bit. Most of the provider complaint request and independent review request against the Blues were concerning recoupments rather than initial denials. And you can see that by just sorting the deny reason, whether it shows, or deny type, I'm sorry. The deny type shows whether it was a denial or a recoupment, so you can see how that works. Does anybody have any questions about that?
So, Patricia, this is Sherry. So when it says question mark answered, and it's got a couple of other different statuses that I'm used to, can you explain what those mean in the spreadsheet?
In the question answered one, or question mark, it means what happened is the provider really needed some specific information or how something worked rather than a denied claim.
Okay.
Or they may have said, okay, we understand it's denied, but could you give us a more detailed explanation? They weren't really challenging it as much as trying to understand it.
Okay, and then my next question would be, NCC/provider, does that mean it was a split decision? What does that mean?
Well, we have slightly changed our status results. If it says MCC/provider-CC, it means, if you'll notice, these are all inpatient ones that have those, inpatient versus observation. And the plan has offered to pay on a corrected claim if they rebill as observation services rather than, pursuing the inpatient in an independent review. So the CC means corrected claim is what it really means.
Okay.
Now, a few you'll see where it says MCC/provider. It doesn't have the CC at the end. And that means it truly was a split decision.
Okay, and so this is Sherry. I have another question about the CC. So if it's a corrected claim, what happens with timely filing? Because so many of these accounts are very dated by the time that it works itself through the kind of appeals process and the provider complaint process. And so does it matter if we're outside of the quote-unquote window for rebill? Is this the Bureau gives permission to bill?
You have you get to begin the normal time. Like the Blues will usually put in their letter, if you'll resubmit with the corrected claim within 120 days of the date of this letter. So they're waiving the initial timely filing and giving you a new one.
Okay, so if for some reason we determine that they're not paying them and denying us timely, what is our course of action?
Well, one, you can come back to us. The other is you may want to reach out to your provider rep. Occasionally these things get missed because, the assigned processor may not remember that it's one of these corrected claimants. Pat, you may want to talk about that some more.
Typically, anytime they come through this process, they go to a specific group of people that actually handle those claims. If there are some that for some reason were denied from, this is Pat Sullivan, I'm sorry, that were denied for timely filing, that should not happen. And so if they just bring those to our attention, if it's gone through this process, we would go in and correct that claim.
Okay, this is Sherry. Thank you, Pat.
Sure.
And this is Linda with the Mara Group, and we will do the same thing. The last sentence in our notification letter will say how many days you have to submit your corrected claim.
Thank you, Linda.
This is Kim Maltempo with United Healthcare. I would say the same thing for us as well.
Okay, and Pat, this is Sherry again. One more question about that. What makes you all decide, or is it the health plan that decides if they're going to authorize a corrected claim? Is there criteria?
For all of those audits that specifically say inpatient versus OBS, then those we have already told them in the recoupment that they are welcome to file a corrected bill for an observation claim. Inpatient. So every one of those would be appropriate for that process unless they felt like it still needed to be an inpatient, which they would then take further steps.
Okay. Again, Sherry.
Well, let me add one thing. Sherry, this is Patricia again. Let me add one thing. We're also working on, and it's going into production, that the audit their vendor uses, the template form, will start to contain that language also.
Wonderful. This is Sherry. I don't think I have any other questions. Thank you. All right, Ms. Patricia, this is Sherry. Do you want to go ahead and review the independent review?
Hold on just a second. Let me get to them. I think we've already done those. I think we've done them both, yes.
You did them. Okay. You were just too fast. Okay. So next on the agenda is the report on prompt pay compliance.
This is Lisa Jordan, and I will give that report. Since our last meeting, the TennCare Oversight Division has tested compliance with the prompt pay statutory and contractual standards for the months of September 2022 through February 2023. We have done the March prompt pay, and we've determined initial results, but those results have not been finalized. So March will be on our next report. I will point you to December and February AmeriGroup's results. You will see that AmeriGroup did not meet the prompt pay standard in December for processing all claims within 99.5% of all claims within 60 days. And then in February, again, the AmeriGroup did not meet the 60-day standard for either the TennCare claims or the Cover Kids claims. We have levied an administrative penalty against AmeriGroup in the amount of $10,000 for failure to meet prompt pay standards in December, and we have given notice of levying another $10,000 penalty for the noncompliance in February. Now, the penalty that we levy is for the noncompliance for the TennCare claims, because that is what the statute pertains to. It doesn't pertain to any other lines of business. However, TennCare, in its contract with the MCOs, has prompt pay standards, and TennCare has the ability to level its own penalty or liquidated damage under the contract. So whenever there are instances of noncompliance, we may levy a penalty under the statute, and then TennCare may also levy a penalty or assess liquidated damages under the contract. So I just wanted you to know that the MCOs do get hit rather hard when they are out of compliance in meeting these standards. All of the other plans, they met the standards for the months tested. So, unless there are any other questions, that's all I have to report.
This is Sherry. Thank you, Lisa. Does anyone have any questions about that, or does AmeriGroup want to say anything?
Yeah, this is Linda with AmeriGroup, and we acknowledged we had issues. We had several issues that contributed to the prompt pay miss. We had requeued claims that had originally rejected. When a claim rejects incorrectly, we identify all the claims that were affected by whatever edit we had. When we removed that edit, we requeue them, and that was caused one of the major effects on our prompt pay.
And right, Linda, I'm sorry, go ahead.
I'm sorry, this is Lisa. And Linda, you can correct me if I'm wrong, but that was the issue in February was just a holdover from the problem identified in December. AmeriGroup did submit to us a corrective action plan that we accepted the corrective action, but it took AmeriGroup a couple of months to catch up. And so our preliminary results for March shows compliance. So we're hoping that we will see compliance going forward. But Linda, if you want to add something to that, please go ahead.
No, I'm good. Like I said, there were multiple, unfortunately, multiple root causes of what happened. So I believe we've addressed them all, and I do not anticipate having another miss. In fact, April right now is looking very good. So thank you.
So this is Sherry again. So not to kind of belabor this point, certainly, but it is in kind of a similar thought. You know, one of the things that we're seeing, at least on our side, and perhaps Dr. Turner wants to respond to this if it affects them, but we are seeing rather long lengths of time between appeal and appeal response. So is that something that the MCOs are focusing on? Because that is a very big pain point for the hospital providers, at least at the Covenant facilities.
This is Patricia. I'd like to address this, and maybe some of the others too, but the Blues were behind on the appeal thing, and that was one of the issues resulting in the increase in independent review requests. They now are staffed up and are moving things much more quickly than they were. They had a period of maybe 12 months where they did not have enough staff, and they had a whole lot of what I call internal appeals, ones that didn't come to our division. We are seeing the improvement now and as an example, we give the plans 30 days to respond to a provider complaint referral, and the Blues are typically getting them in about 21 days now. They're very, very prompt. So, Pat, you may want to address that too, but I think that's improving.
Yes, this is Pat. Patricia, I think you did very well in addressing it. Thank you.
This is Dr. Turner. I will just say that at Murray Regional, we are experiencing similar issues as reported by Covenant.
So this is is Sherry. So just would love just to kind of, have that potentially be something just we can respond to at the next meeting. We're certainly keeping an eye out. We're also communicating with provider reps when we see those significant delays. But we do appreciate, Pat, the work you all are doing at Blue Care to help turn those things around faster. It will definitely help matters, and we look forward to that with United and AmeriGroup as well. So this is Sherry again. Next on the agenda is any new business. Typically we discuss setting the next meeting date, but we'll defer to Lisa in the event there's some other new business we need to discuss.
This is Lisa Jordan. I have a couple of things. First of all, wanted to report that the panel was scheduled to sunset or terminate June 30 of this year. We went through the sunset hearing process, and so the panel was extended through June 30, 2028. So I'm sorry, you're going to have to meet again. And then also, just to let everyone know, because of some issues brought to our attention by the MCOs as well as some providers on how some of the reviewers are writing up their decisions, it's causing some confusion as to, well, wait a minute, was it upheld or was it overturned or was it a partial, and we're not exactly sure what we're supposed to do. And so we looked into that, and we agreed that there's opportunity to standardize the language. Of course, we can't tell the reviewers what they decide, but we're hoping we can work with them to make their decisions more clear. And so Patricia and I are involved in that right now, and we hope that will resolve some of the questions that we've been getting.
So, Lisa, this is Sherry. So when you say reviewers, it's either MCO or vendor, or one or the other, or both, I guess.
We mean the independent reviewers that get the cases that come up through independent review. There's a template they base their decisions, format on, and we're working with that format to give them opportunities to be much more specific, in particular when dealing with inpatient versus observation.
Okay. Thank you. That was helpful.
And this is Lisa again. And going back to Sherry, the issue you raised, and Dr. Turner saying that you've seen instances of appeals taking an awful long time to be resolved. The prompt pay data that I report to you will not capture that. So if any providers are experiencing significant delays in getting their appeals handled, we would really like to know about that and get some specifics so we can work with the health plans to see if that can't be resolved. As Patricia reported, and Pat, we've all worked on the delays that Blue Care was experiencing because of staffing issues. But if you continue to see any delays, we want to know about it.
Lisa, this is Sherry. Thank you very much for that. And even some of the delays may be on the vendor side as well, because we typically interact with them kind of before it goes to the health plan. So I'll certainly have my team pull that data together. So with that said, is this the appropriate forum to present that, or would you like us just to send that information to you directly?
Send that to us directly.
Okay.
Send that to my division directly.
Okay. So this is Sherry again. Another question, and it may not be appropriate for this panel, so I apologize in advance. But one of the things, and that I think providers across the state are experiencing, obviously, is the high volume of audits, as we've somewhat discussed a little bit here. And we really are looking at ways to automate requests, responses, and things like that to decrease the administrative burden on both parties. And we did notice that when Blue Care switched from HMS, who I know Covenant had an automated process with, and they engaged with Cotivity, that we have lost some of the efficiency gains that we had before. So we would certainly love to just really, as interoperability and those type of things come to be, to really, look to try and move us back to the future of where we could get things, requests sent to us, get rid of mail, get rid of faxing, and really go back to that. And it was just really unfortunate that the vendors are not allowing that. So I don't know if the Bureau or your department has any say in that, but again, it would certainly be helpful.
Hi, Debbie, this is Pat Sullivan with Blue Care. I wasn't aware that we lost efficiencies as a result of that, because it was really just HMS going to Cotivity was just Cotivity purchasing HMS, and then supposedly the thought was they were going to perform the exact same function. So if you have someone that you want to send to me that I can have someone reach out to try to work through whatever those inefficiencies created, we can certainly do that.
This is Sherry. Pat, that would be wonderful, because it's been a huge hit to our organization, especially as large as we are, that we lost that. We've really kind of gone back many, many steps in some, like I said, those gains. So I'll definitely do that.
Okay. And I said, Debbie, I apologize. Sure.
That's okay.
So,
that's okay.
Email that to me, and I will connect, have someone connect with you.
That would be wonderful. Thank you.
Okay, great.
Okay. So with that, Lisa, do we want to discuss the next meeting date?
Yes, I think that would be great if no one else has anything to bring in front of the panel. I think looking at either September, second half of September, or sometime in October.
Okay. So this is Sherry. Does anyone have a preference? If not, we can September 28th, or we have October 5th even.
I think September the 28th would be fine.
Any objections? Then September 28th it is.
At the same time, 1 o'clock
Yes.
Central, 2 o'clock
Yes, ma'am.
Eastern.
Yes, ma'am.
All right.
Hey, this is for Farragut. Are you going to send out like a meeting planner, an Outlook, or a Teams meeting on that? I almost didn't make this today because it wasn't on my calendar.
We could start doing that.
Yeah, we typically just send out an email with the public notice, but we can. Who just asked the question?
Linda.
Linda.
Mm-hmm.
We'll see if we can't do that, Linda.
That would be fantastic. My calendar is absolutely crazy, and I had to move things around because I wanted to make sure I was on this call today. Lori Stifler, our regulatory director, did receive an email, and she forwarded it to me, but by then I had already had my calendar booked. So, yeah, that would be fantastic if you could do that. I truly appreciate it.
So this is Sherry again. So Lisa and Pat, when it says that it's open to the general public, I've had several of my staff ask me if they could come. So it sounds like that is not a problem. Now, would they have to formally introduce themselves, or could they be in listen-only mode?
Certainly, anyone. This is open to the public, so anyone who wants to attend the meeting is welcome to do that. Unless they wanted to speak, I don't think that we don't have to take an attendance of everyone who is listening in to the meeting. I think it's just if someone wants to speak, they would need to introduce themselves.
Okay, very good. So if there is no other business, I guess we're ready to adjourn.
Thank you so much, everyone.
Yes, thank you so much for your time, and have a great summer.
Thank you.
Bye-bye. Bye-bye.
Thank you.
Bye-bye.
The 28th. Told you it wouldn't take
That's
too
okay.
long.
Gives me an excuse to work from home the rest of the afternoon.
That's very good. Exactly. Exactly.